Welcome. So today we have Dr. Christina, who is going to be telling us all about the many uses of BHRT, which is bioidentical hormone replacement therapy. I'm Dr. Danielle O'Connor, also a naturopathic doctor. So it's wonderful to have Dr. Christina here, speaking with another naturopath and really answering all these questions for everyone. So in today's webinar, you're going to get a deeper look into BHRT and really learn the benefits and risks, as well as the differences between bioidentical and synthetic hormones, conditions other than perimenopause and menopause. That's ones that we always hear about treatment with BHRT for, that people can really benefit from, the effectiveness of BHRT in combination with herbal medicine, the safe age groups to administer BHRT, and whether you may be a candidate for bioidentical hormone replacement therapy or not. So welcome, Dr. Christina. Please tell everyone a little bit about yourself.
Yes, thank you so much, Dr. Danielle. My coworker here is Denise, so it's a very similar name. But thank you. It's great to be back here again. It was great when we did it the first time around. So yes, I am a naturopathic doctor in the Oakville area. I've been in practice for over 15 years now, and I do see a lot of women patients, and I have learned over the years that bioidentical hormones can be a great adjunct to help my patients. And it does go beyond the menopause, perimenopause. And it's amazing that when someone suffers from deficiencies in certain hormones, how they're feeling. And once we test and see what they're low in, and the big one that I will talk about today is progesterone, of course, the bias, that one as well, but that one is more so for perimenopause, menopause. But I find that the hormone progesterone can be really beneficial for so many things. So yeah, we can get started and start talking about it.
Wonderful. Okay, so we're going to start right from the beginning. So what is the difference between bioidentical hormones and synthetic hormones, and really what are the benefits and risks with that?
Yeah, that's a great question. So synthetic hormones are basically man-made, and they do use chemical compounds. The other thing is that the molecular structure is not the same as our body. So it's something that is different. When we look at the bioidentical hormones, the molecular structure is actually close to our own molecule cells. So when you have that, your body can better adapt to it. The other thing is it's usually derived from a plant source. So it is more natural. It's not man-made chemical compound. So the effects would be much, much better when you're using the bioidentical.
Amazing. And then what about the risks between the two? So the synthetic, the risk around
Yes.
synthetic versus
Yep.
the risk around bioidenticals, because this is a huge question, right?
It
Make
is.
sure they're taking something safe and which is going to be the better option for them.
Yeah, that's a great question. So I know we briefly talked about this in the previous webinar as well. So there was this big study that came out in 2002 where they were using the synthetic hormones. And the point of the study was to see how women are benefiting with osteoporosis and cardiovascular disease using the synthetic hormones. And what they found is that they needed to cut the study short because women were getting blood clots, strokes, and then the big one was breast cancer. And when this happened back in 2002, there were a lot of medical doctors that just stopped altogether. Like, we're not doing this. This is causing more harm than good. And that's how we do things. It's causing more harm than good. You got to stop that medication. And that's what happened with the synthetic hormones. So then bioidentical hormones were around for a while. I believe they started in the 40s, believe it or not. But it became more popular after what happened with the synthetic hormones. So more and more people are like, okay, what are these bioidentical hormones? So with bioidentical hormones, we do use the combination of, and not always a combination, there's the bias, which is a combination of estradiol and estriol. And of course, it is in a natural form. And then we use the natural progesterone. Now, I've looked again, like through studies as to like, are there any risks? Now, usually when there are risks, we always worry about the estrogen because someone that has, let's say, an estrogen prone or estrogen positive, cancer, then, maybe they should not take the estrogen. And we don't have enough studies to show, yes, it does cause cancers. But the one thing that I want to mention, which I did mention before as well, is that if you are to give IS to a patient, I always supplement it with progesterone. I never give estrogen by itself. And so if there is, let's say, a risk of potential cancer down the road, if there is, the progesterone, the natural progesterone cream will counteract that effect because it actually prevents the proliferation of cancer cells. So I think that's the key that I need to mention. Maybe there will be a study down the road where they realize even the natural estrogen could be a problem. Haven't found that yet. There's no studies there yet, but there are studies to say, hey, even if there is a risk, progesterone will counteract that. So therefore, we're actually preventing cancer from occurring, which is the big thing for a lot of women, and that's what they're worried about.
Absolutely. And we also know, like, there's a lot of wonderful benefits to having that estrogen and progesterone, right? Whether it's
Yes.
our cardiovascular health. And
yes.
So there's definitely benefits to wanting to maintain those levels. Now, again, we do speak about bioidentical hormones and hormone replacement therapy in general when it comes to, that age group of perimenopause, menopause, 40s and 50s, and really helping with that transition. But is it just for that specific age group, or, where else can people use it? At what ages?
That's a great question. You can start, and again, any time that I would prescribe bioidentical hormones, I always test. So I always do hormonal profile. I may do blood work, but the one that I usually love to use is the Dutch one, which is the dried urine, just to see what's happening with the hormones, with the estrogen, with the progesterone, with the testosterone, even adrenals. It gives us a good profile. So to answer your question, how young can they be? It can be as young as 16 to 18. I would say 12, 13, 14, their body is still going through that transition phase where it's the first time they got their period. So there's going to be hormonal changes, ups and downs. So I would say that age group, no. But 16, 17, 18, but then again, it also depends when they first got their period. Most girls get it between 12, 13, but sometimes it could be 15 or 16. And if that's the case, then I would delay it even more. Then I'm looking at 18 or 19. But what I would always do is always test. So if I have a female coming in and they're complaining of like a lot of symptoms. So symptoms could be, well, I am experiencing some breast tenderness, or maybe some irritability or anxiety, or I have difficulty sleeping, or I get migraines. These can be all potential signs and symptoms of low progesterone. So I would do the profile, and then, well and behold, we'll see, oh, you know what? Your estrogen is on the lower end. So I would start giving them just the progesterone, because again, we don't touch the estrogen when they're that young. We save that for perimenopause, menopause. But at that teenage, early 20s age group, I would give them the progesterone, and we would cycle it with their period. So we would do it like either I do 2 weeks on, 2 weeks off, or I may start them from day 10, taking it to day 14, and then increasing it slightly from 15 until they get their period. And typically I would do like a lower dose. Again, it depends on how low it is. I usually find that that age group is not like severely deficient. So dosaging, again, would depend on what comes up on the test. It could be anywhere from like 20 milligrams, 15 milligrams. And what's great about the compounding pharmacy, they can measure it to what we want, which is what I love. And it's measured per click. So we can do 20 milligrams per click, 15 milligrams per click. And we do it for a short period of time. It's not like, oh, does this mean that she has to be on progesterone cream forever? We cycle it. So we do it for about like 3 months. See how symptoms improve. If things are better, I may slowly get them off it, stop altogether. If things are not improving, we may retest again, because sometimes you need to be on it for a longer period of time. But I have seen it work amazingly. So yeah, we're looking at as early as 16, 18, I would say around there. And then yes, of course, the age group that we talked about. But yeah, it's incredible that you can start using it as early as like late teens or early 20s because of the deficiencies of progesterone. So, I've seen amazing results, which is great. And yes, and then when you have a young girl coming in with all those complaints and you realize it's a low progesterone, it's amazing how great they feel. even the bloating too, right? They get that bloating, and progesterone acts like a natural diuretic as well too. So it's fantastic as to how it can really help.
Yeah, that's amazing. And it seems like nowadays the go-to treatment for any, period issues or, irregular cycles, that type of thing is going to be the birth control pill, right?
Yes.
So just having people know that there's other options. Okay, yes, not for birth control, but in terms of if you're being prescribed the birth control pill for all of these symptoms, right?
Yes.
So,
Yes.
yeah, great use. And I think that we really need to be getting this information that you're talking about out there, because people don't realize that this is definitely an option for them. Really, as long as you're menstruating, this is an option, right? So
yeah, exactly. Which is incredible. So yes.
Yes, wonderful. Okay, so we spoke about a little bit in terms of the, like with the periods, but can, bioidentical hormone therapy really be used to treat other imbalances? Like, what are some of the symptoms that people might be experiencing that you do find improvements when they do use BHRT?
Yes, I mean things like low energy. Again, could be one of the big things. Brain fog, mood swings, bone health. Like if you're osteopenic or going towards osteoporosis, even helping with just overall cardiovascular health as well. Another big thing is for fertility as well too. So a lot of times women who are having difficulty getting pregnant usually has to do with low progesterone. And that's, we can use it as a suppository, which can be very, very beneficial. Migraines can be another thing as well, weight gain, even skin issues like rosacea or psoriasis, acne. A lot of times, the hormones can, the bioidentical hormones can help with that because it's related to for instance, low progesterone, right? So we do the blood work or we do the Dutch test, we see where they're at, and then we start with the cream. So the cream normally is the main thing that I like to do, and then the suppositories would be more so, I would find, helping with fertility.
Right. Okay. So yeah, so very many uses outside of just the strictly helping with like those hormones, right? So now another thing is can you use bioidentical hormone replacement therapy along with other therapies, whether it's, vitamins, whether it's herbals, can you use it in combination, or is it something that you use just all by itself?
That's a great question. And actually, I do like using it in combination. So, going back to, let's say, using the progesterone cream, and, we're using it for, let's say, anxiety, stress, insomnia. I like to also add other things to it because a lot of times we may need some sort of adrenal support. So maybe adding a rhodiola or an ashwagandha or Siberian ginseng. If they are dealing with anxiety, I may add something like magnesium in there as well, or L-theanine. So I do find adding these other things alongside with it is a great adjunct, and it just allows everything to work synergistically together, and you get better results as well.
Absolutely. No, this is great. So many options, right? In terms of and so much help out there. Now, in terms of BHRT, what forms can be used? And just tell us a little bit about like the forms, how to use it, that type of thing.
Yes. So the synthetic ones are the ones that come in pill form. As naturopathic doctors, we don't use the pill form. We use the ones that come in the cream form. So that would be the topical application where you would apply it in your inner arms or lower legs. And the other option is the suppository, which we would use as a vaginal suppository. So the suppository and the topical creams is the method that we use as naturopathic doctors. And then the way it's we've mentioned this briefly before as well, that when you do the cream, it's also catered to the patient, and the dosing is based on per click. So, we can do, again, the progesterone could be anywhere from 20 to 60 milligrams. The estrogen could be as low as 0.5 to 2 milligrams. And then based on the result that we do through the testing, we adjust it accordingly. And then topically, we apply, like I said, in the inner arms or lower legs, and then we always rotate the spots. So usually estrogen will be in the morning, progesterone would be in the evening, and then we rotate it between the upper and lower arms. And the reason why we do that is to prevent like saturation of the cream to one area, and then therefore it doesn't get absorbed as well. So rotation is the key. So creams and suppositories is the way we do it. The pill form is typically done with medical doctors. The synthetic form.
Yes, definitely. And the bioidentical hormones, I think you've already mentioned this too, they are made in a compounding pharmacy. So it's always a measured amount, right?
Yes.
It's not just a tub of cream that, somebody's getting and putting it on kind of willy-nilly. It's always,
Yeah, and it's great because it comes like as a click. So it's great. You don't have to worry about it getting it on your fingers or getting all messy, kind of scoop it out and then potentially contaminating it. I mean, you will get it on your fingers when you're rubbing it in, but the key is it's just a click. You get the right dose. Yes, you rub it in, and then of course you wash your hands afterwards, but it is measured. It's like she said, it's not a tub of cream that, you're just trying to apply and measure or get a quarter teaspoon. Well, every spoon's different. How are you getting the exact amount? So yes, it is measured, and that's what makes it fantastic and very easy to apply, especially for the younger generation too, right? I find that it's much easier when it comes as a click and they can easily use it.
Yeah. And even in a cream form, just being able to have that option where it's not something else that, you're taking orally, right? So, wonderful.
Yeah. And then of course, also transdermally, you are getting better absorption. I should mention that too, because when you're taking something orally, well, it has to be broken down by your digestive enzymes. Where's your gut health at? No one has 100% perfect gut health. So how much of it are you really absorbing? Where when you do it transdermally, you're bypassing a lot of that. So you're getting the amount that's being applied transdermally. So it is a better way to go versus using oral.
Amazing. Wonderful. Well, thank you so much. This has been such great information in terms of, the many uses of bioidentical hormone therapy. So it's not just for women in perimenopause and menopause, but really through all, stages of a cycling woman's life. So this is great information. Thank you so much for joining me today and really educating us on this topic. It's just wonderful information. Really appreciate you being here. Thank you.
Oh, thank you so much. Thanks for having me again. I really love talking about this topic. And yes, thanks again. It's been fun.
Perfect. Thank you.